Chapter 6, CNS Depressants, Sedatives and Hypnotics. Today we're going to talk about the nature of CNS depressants, their effects, similarities, and differences among common CNS depressants. So, your central nervous system basically integrates information that it receives from all parts of the body. It coordinates the activity of all parts of the body, which consists of the brain and spinal cord, and it plays a fundamental role in the control of behavior. CNS depressants are some of the most widely used and abused drugs in the U.S. Low doses produce a high, relieve stress and anxiety, and induce sleep. Many who become dependent obtain them legitimately. They're either prescribed by a physician, but they're also available on the streets, but to a much lesser degree. These CNS depressants include benzodiazepines, barbiturates, alcohol, antihistamines, and opioid narcotics like heroin. Many who become dependent obtain them legitimately. So they were prescribed by a physician. And I already said this slide. Moving right along. Introduction to CNS depressants. So why are they so problematic? They're usually obtained legally and are prescribed. They can cause alarming, dangerous behavior if not closely monitored. Most problems occur due to inadequate professional supervision and chronic use. And many other drug groups have the ability to cause CNS depression and are taken together. Some of the behavior that is associated includes bizarre and dangerous interactions, example with alcohol. It can cause disruptive, unpredictable, sometimes life-threatening personality changes. History of CNS depressants. Before modern drugs, the most common depressant was alcohol. This helped to ease people's tension, cause relaxation, and help them to forget their problems. The search for new drugs to treat nervousness began. In the 1800s, bromides were very popular, but they had a very high toxicity level. In the early 1900s, barbiturates replaced bromides. There was problems with tolerance, dependence, and lethal overdoses. Doses needed to impact anxiety, but it would impair someone's respiration and their mental function. The margin of safety was much too narrow. In the 1950s, benzodiazepines substituted barbiturates. They were relatively safe for short periods, but long-term use can cause dependence and withdrawals. Prescriptions can be problematic because they are prescribed for stress, anxiety, and apprehension, without first trying therapy or counseling or other methods. There's an undesirable message, a simple solution to complex problems, so a way for someone to cope is just write them a prescription. The epidemic of prescriptions in the 1970s and 80s, where women were 2 times as likely to receive medications, and this still happens today. Within the medical field, there's increased awareness and decreased use, but we're still searching for that magic pill to help cope with our issues. Effects of CNS depressants, benefits and risks. The ability to reduce CNS activity and the brain level awareness. So they're classified based on the degree of medical effects on the body. Effects are dose dependent, so the same drug is used for different effects. For example, sedatives cause mild depression of the central nervous system and relaxation, sometimes within their muscles, and it helps to treat anxiety. Hypnotics are used to promote sleep by inducing drowsiness. It can produce an amnesic effect, and anesthesia will help put somebody in a deep depression of their CNS system to achieve a controlled state of unconsciousness. Comfort without memory of procedure. Increasing the dose much more will cause coma or death, except with benzodiazepines. The CNS becomes so depressed that vital centers that control breathing and heart activity cease to function. So persistent use causes tolerance. Increased use will lead to dependence, and dependence can be so severe that abrupt abstinence can lead to severe withdrawals, including life-threatening seizures. Types of CNS depressants. The differences in margin of safety and potential abuse impact the therapeutic advantage. Unique features of some make them useful for treatment of other medical problems. For example, barbiturates and benzodiazepines will treat seizures, and opioid types will treat pain. Unique features also impact abuse potential. For example, abuse is more likely with fast-acting ones. Benzodiazepines and Valium-type drugs. Benzodiazepines. They're most frequently prescribed for anxiety and sleep. They're allowed by a wide margin of safety. For example, Valium was introduced in the 1960s. It was a top-selling and has been replaced now by Xanax, Ativan, and others. There is a concern that these medications are being overprescribed because there's that perceived safety, but problems with abuse potential do exist, and physicians will warn against prolonged or unsupervised use. Due to dependence problems, they're classified as a Schedule IV drug. They're very popular and profitable, and several prescriptions are written for these drugs. Medical uses. So some of the medical uses include relief of anxiety, treatment of neurosis, as a muscle relaxer, alleviate lower back pain, treatment of some convulsive disorders, sleep induction, relief from withdrawals associated with narcotic and alcohol dependence, and amnesia for surgery. Mechanisms of action. Selectively, they affect neurons that have receptors for the neurotransmitter gamma-aminobutyric acid, or GABA. GABA is an inhibitory, which it helps to calm the brain and helps create balance, and it affects the mood, which is in the limbic system, reticular activating system, which is drowsiness, and the motor cortex, which is muscle relaxation. Benzodiazepines enhance the GABA inhibitory effects. Likely natural benzodiazepines exist and activate these receptors to decrease stress and anxiety naturally. And antagonist drugs, such as flumazenil, are used to treat overdoses, so you have to be careful because this can lead to withdrawals. Types of benzodiazepines. Approximately 15 compounds in the U.S. are considered benzodiazepines, and approximately 20 others in other countries. It's distinguished primarily by the duration of action. So the range is anywhere from 1 to 12 to 25 to 41 hours. Short-acting is used as a hypnotic, and long-acting are used as sedatives. One reason for long action is that metabolites are as active as the original. Side effects. Some of the side effects include drowsiness, lightheadedness, lethargy, impairment of mental and physical activities, skin rashes, a decrease in libido, menstrual irregularities, blood cell abnormalities, and sensitivity to other depressants. Only very high doses can impact respiration unless combined with others. There's less effect on your REM sleep and restful sleep. Prolonged use as a hypnotic can have a rebound effect. Sometimes it has a paradoxical effect such as nightmares, restlessness, hostility, and even paranoia. Tolerance, dependence, and withdrawal and abuse. Frequent or chronic use can cause tolerance, physical and psychological dependence, and withdrawals. Not as severe as other depressants, but only after prolonged use. For most, effects aren't reinforcing, so they're not as addicting, except among alcoholics. They do find the effects of these medications rewarding, so it should be prescribed with caution to those with a history of drug abuse. You have to have extreme caution. Sometimes used as a secondary drug of abuse, combinations often counteract the negative effects, and withdrawals can mimic the condition. Clinicians may not realize that dependence is occurring, so long-term use in high doses can lead to severe withdrawals, depression, panic, and convulsions. A person should gradually wean off of these medications. When properly done, there is no evidence of cravings associated with it. Some date rape drugs, because they have a sedating and amnesic effect, are within this category. Barbiturates. Barbiturates are derivatives of barbituric acid. It's used in medicines as sedatives and hypnotics. The first one was barbitol in 1903. Names traditionally end in "all" because they are chemically related to barbitol. Less than 2,500 are synthesized, and approximately 50 are approved for human use. Due to serious side effects and a narrow margin of safety, only a few are still prescribed, approximately 12. They have been replaced by safer ones, such as benzodiazepines. Short-acting classified as Schedule II, and long-acting are classified as Schedule IV drugs. Barbiturate misuse. Uncontrolled use can cause acute or chronic intoxication. Initially, the effects are similar to alcohol. As a sedative, it can cause delirium and other side effects. As a hypnotic, it can cause unnatural sleep because it will decrease your REM cycle. Continued misuse has a cumulative toxic, life-threatening effect. Severe tolerance, such as physical dependence, withdrawals, can also include seizures. When combined with alcohol, it may cause death from respiratory or cardiovascular depression. Effects and medical uses. Effects range from mild sedation to coma. Depending on the dose, it will affect nerves and muscles. Sedative and hypnotic doses only will affect the CNS. It will help relieve tension and anxiety, but it has a very high abuse potential. Anesthetic doses cause a decrease in blood pressure, heart rate, and urine flow. A few are still used for medical purposes. Long-acting phenobarbital for convulsions from epilepsy and seizures caused by stimulants, or pentothal and other ultra and short-acting for anesthesia or for surgery. Negative effects. Drawbacks are extensive and severe. The lack of selectivity and safety, high tendency for tolerance, dependence, and withdrawal and abuse. There are problems with drug interactions and can cause liver damage due to exaggerated response trying to inactivate the medication. These drugs are less frequently abused in the U.S. as they are not readily available. Mechanisms of action and elimination. Precise mechanisms are unclear. There's likely also a reaction with the limbic system and the reticular activating system, as well as the motor cortex. There doesn't seem to have a specific receptor site, but they still are generally enhanced. They generally will enhance the GABA activity. Fat solubility affects the duration of the effects. Ones that are most fat soluble can move in and out of tissue faster and are likely to be shorter acting. Fat content of body can influence the effects since it is stored in the fatty tissue. Women have different reactions than men, as they typically have more body fat than men. Withdrawals often cause hyperexcitability due to rebound of depressed neural systems. Other CNS depressants. Substances from other chemical groups can also depress the brain activity. Non-barbiturate drugs with barbiturate properties have significant abuse potential. They're typically your Schedule II or IV drugs, and include drugs like chloral hydrate, glutamide, and methprolon, as well as methaqualone. Combining with alcohol has very dangerous consequences. Other antihistamines. They're used for common cold, allergies, and motion sickness, as well as sedatives and hypnotics. They seem to block acetylcholine receptors, causing relaxation and sedation. They're viewed as relatively safe agents, and they don't seem to cause dependence, although sometimes abused by youth. Tolerance can occur quickly, and significant withdrawals are rare. One problem is variability of responses. Therapeutic doses cause decreased alertness, relaxation, slowed reaction time, and drowsiness. The opposite effect in others, such as restlessness, agitation, insomnia, seizures with toxic doses. Others, there's a new generation of sleep aids. Insomnia treatment claiming less sedating and less likely to cause dependence. These drugs include those that you see advertised on TV all the time, including Ambien, Lunesta, and Sonata. They can cause next-day sedation and amnesia. For example, did I take my kids to school today? Dependency has also resulted, especially when used with other depressants, such as alcohol. Other GHB, a natural depressant. GHB is colorless, tasteless, and odorless. It's found naturally in the body, resulting from resulting from the metabolism of GABA. It's used for general anesthesia, insomnia, narcolepsy, treatment of alcoholism and withdrawal, and narcotic dependence. It became popular for recreational use due to a pleasant alcohol-like hangover, a pleasant alcohol type of buzz, but then the person would be free from a hangover the next day. It was used as a club drug, taken orally after mixed with liquid or a beverage. Rapid onset, large doses can cause unconsciousness and coma within 15 to 40 minutes, requiring hospital treatment, rapid recovery and would regain consciousness within 2 to 4 hours. It was made a Schedule I drug in 2000. High doses can be deadly. Side effects include nausea, hormonal problems, abnormal sleep, and an increase in blood pressure. This is also known as a date rape drug, as it could be slipped into an unsuspecting person's drink because of it being colorless, tasteless, and odorless. Patterns of abuse. The APA considers dependence on CNS depressants to be a psychiatric disorder. Those most inclined to abuse include those who deal with emotional stress, those who feel exhilaration and euphoria instead of depression, those who use it to counteract withdrawals of negative drug effects, and those who use it with sedatives with depressants. It's not common to see joint dependence on depressants and narcotics. Treatment for withdrawal. Duration and severity of withdrawal depend on the particular drug. Short-acting tend to be more severe. Their approach to detoxifying depends on the drug, severity of dependence, duration of action. The goal is to eliminate dependence safely and minimize discomfort. Detoxification is insufficient by itself. Basic approaches use substitution, then gradual reduction, which includes vitamins, electrolytes, and dehydration prevention. The need to solve the underlying problem to deal with the psychological dependence still is there. Natural depressants. Plants containing naturally occurring CNS depressants and herbal products and teas. They are used for relaxation or treatment of sleep problems. They are legally sold and often in health stores. Some examples are kava kava. In small doses, it can produce euphoria and sociability. In larger doses, it can provide relaxation, lethargy, and sleep. The Datura family of plants in small doses can encourage sleep, and in large doses, hallucinations. And that is the end of Chapter 6.